So welcome to Coffee with Grant and Thomas again. And Thomas, what's the subject today?
Yeah.
What have you got for us?
Our subject today is urinary tract infection, something that is very common, very uncomfortable, but the good news is very easy to treat. Right, here we are. UTIs, as many people know it, urinary tract infections. What are the symptoms, the causes, and the treatment? First of all, the symptoms can be a variety. Most common one is an urge to urinate frequently, even small amounts, and once you've gone a few minutes later, you feel like you've got to go again. There could be a burning sensation when passing urine. It's very uncomfortable. Passing frequent small amounts of urine, or urine that may appear a bit cloudy. That is an indication that there's an underlying infection of the bladder or urinary tract. And then maybe even a sign of blood in the urine, such that it appears red or bright pink or Coca-Cola colored. A strong smelling urine is usually an indication that there's an infection within the bladder. And then pelvic pain, in women especially in the center of the pelvis, around the area of the pubic bone. If you've got pain there, there's a very good chance that there's urinary tract infection. Please also remember that these short clips that we do cover probably 90% of conditions and how to treat it. It is not comprehensive, and there might always be other symptoms that are less common and other causes of it. The causes of the urinary tract infection is that it is quite common, especially for women. And the reason for that is just the anatomy, that the urethra is relatively short from the bladder to the outlet. And because of its shortness, bacteria can easily get in there and cause infection of the bladder. One of the most common ones is a bacteria called E. coli. And sometimes in certain conditions, sex may even cause urinary tract infections because of the friction during sex. It causes the natural immune system of the mucosa to be reduced, and bacteria can proliferate. And then, as I said, because of the anatomy in women or in girls, it is just more common there, although many men also get that infection. How do you treat it? As I said, fortunately, they're easy to diagnose with those symptoms that I mentioned in the beginning. And we treat it by drinking Quantum.Silver, 50 milliliters 2 times a day for minimum 5 days, or 1 Quantum.Silver capsule 2 times a day for 5 days. So either or, whichever you prefer, it's the same dose, they're both as effective as the other. And even if your symptoms feel better within a day or two, keep on drinking it for 5 days to make 100% sure that that infection is cleared up and it won't come back quickly. And then to prevent reinfection, that will also help if you finish the course and just reduce the bacteria available. And that what can also help is just to make sure you drink enough water, because that flushes that extra water through the kidney and the bladder and keeps the bladder clean from any possible infections. Go to the toilet frequently as necessary, and obviously personal hygiene is always important to prevent future infections. Thank you. So that just clears that up. A very, very common condition, very uncomfortable, can be very painful, but as we have seen here, so easy to treat. And the quicker you start, the quicker the response is, and the quicker the restoration to full health. Thank you.
Thomas, once again, very, very informative. And it is, as you say, very, very common, but it's what's quite nice to see how simple it is to treat, because some people are almost embarrassed about things like this. And it's quite a simple, non-invasive way to fix it.
Yeah. At the same time, should there, for example, in certain people maybe have a sexually transmitted disease, which causes infection there. This same treatment will also clear up that infection. So that's the good news. It is not selective. Whatever infection there might be will be cleared up.
Well, that's brilliant. Thomas, thank you very much for joining me on Coffee with Grant once again, and looking forward to the next session.
Thank you. All the best.